So now we're going to be moving over to Maria Mason. Maria is the Vice President of the Federation of Holistic Therapists and has been a holistic practitioner qualified in over 15 therapies. Maria, over to you.
Thank you, Naveed. Hello, good afternoon, everybody. I'm not using slides, but I absolutely loved Tony's presentation. It was wonderful. So I'm talking to you today from my private clinic. I am a massage therapist and, as Naveed has said, qualified in many different therapies. So, I mean, who doesn't love a massage? But there are so many reasons to have massage. The definition of massage is to relieve tension and pain in the soft tissues. It treats stress, pain. It's just a really amazing well-being therapy. And I've literally been doing massage before I came on here. So the origins of massage go way, way, way back in history. And in India, Ayurvedic medicine used massage. We know about gladiators going into fights, having massage before and afterwards. So massage is a lovely therapy, and it comes under the title of touch therapy. It's literally a touch therapy. So most people have had some form of touch therapy, even a little arm massage, or just when somebody just literally makes that contact with you. We're human, we're physical, we love contact, and it does so much for us. But more on how it works, we have to start to think about the mechanics of the body. So the body is full of different muscle groups everywhere. And many of the muscle groups work together. Bicep, tricep, hamstrings, quads, they work in pairs. And the spine has many muscles that run off of it. So if we imagine, so here in the top of our neck, this is often, I'm going to talk about where often we see tension. So here in this part of the body, we have a lovely muscle called the trapezius muscle. It runs up the top of your neck, over your shoulders, and down your back like a kite. Now, I often see people coming into my practice that are kind of a bit like this, and people talk about tension. So what happens in that time where that muscular tension gets into the body is often we hold the tension in the muscle, and then it becomes like a subliminal thing, and we continue to hold that. And factors that affect that are stress. Most people deal with stress at some time in their life. And we continue to hold the muscle in this particular way, and it just remains there. But what's actually happening in the body is we've shortened this part of the muscle. We've made tension. And in doing that, what's happened is that is offset through our body. So if we've shortened the muscle here, it's probably we're going to feel a lot of tension and restriction down this side, or even deferred pain in this side. So the aim of massage is to smooth out. I feel literally I want to do a massage, everyone. Smooth out that tension and bring that length back to the muscle, that form, restore the muscle to where it was before. And in doing so, that aligns the skeletal system as well. So it increases blood supply. That's really important because if we've had any injuries, we want the blood supply to come in. So I see a lot of runners, I see a lot of sports people in my clinic, and increasing the blood supply brings those building blocks back to the muscle to repair. Every muscle has an origin and an insertion. So it has an origin where it's attached to the bone and an insertion where it's attached into another muscle. So if we have had a shortening, again, it pulls out the skeletal system. So different forms of massage, lovely long strokes of massage which soothe the body and make that lovely contact. In your skin, you have lots of sensory organs. So that initial contact with your therapist is really important, and it sets up a trust and it sets up a connection with the therapist. Qualified therapists will always sit down with you at the beginning of your treatment and discuss where your pain is. When I learned to become a massage therapist, I literally learned to massage with my eyes closed, because as therapists, we can actually feel where that tension is in your body. We can see it, but also we can feel it. So a lovely consultation at the beginning. any fear that you may have about having a massage, any questions that you may have. We can answer those at the beginning. And then you would literally come onto a couch like this. This is my treatment room. So you'd literally pop yourself onto a couch like this. It's all very discreet. You're left to, often you just leave your underwear on and you'd be under a towel. So it's all very discreet. And then the therapist would come back into the room and physically have a little look at where the tension is. We discuss the pressure. So for some people that don't have regular massage, any deep form of tissue work can be uncomfortable at the beginning. So going back to those different kind of massage strokes that we do, those long, lovely massage strokes, get you used to the therapist, warm the tissue. So it's like when you do sport and you warm up. We're warming up those muscles to get them going. And then we're going to use various forms of massage, pressure, deportment, different types of massage to try to get the muscle to go back to its former shape. And we also rely heavily on the point that the blood is pumped around the body by the heart. We all know that, and that supplies each and every muscle. But we have a lymphatic system that runs alongside our blood supply. And things like lactic acid are a byproduct of when we use our muscles. So have you ever been running and you've been afterwards got cramp or anything like that? This is a byproduct. It's a waste material that comes from when the muscle works. Now, because the lymphatic system in the body doesn't have a pump, massage is a great way of releasing toxins from the body. So when we do the massage, what happens is it presses down on the lymphatic system and it helps that to move through the body, which moves out of the body through excretion. So you can have any area massage. You can have a foot massage, a hand massage, a back massage, or a very professional full body massage where only the bit that you're having massage is exposed. If I'm working with somebody for the first time with massage, then I probably would do just a back massage to build up their confidence. It's really, really important during massage that we make that really strong connection with the client to help them relax. Because if somebody comes in and they're nervous and they're just going to hold that tension, they're just going to hold that tension in the body. So there are many, 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 many benefits. Emotional connection. When we're living in such a big digital world now, and we probably have less connection to people physically, the physical aspect of touch is a really powerful tool in well-being. And just to literally do a hand massage, I have some quite elderly clients that come to my clinic and they're just happy for me to do a massage on their hands. And, you know, that can relieve tension from arthritis, osteoarthritis, all sorts of different tension. We can use a medium like oil. We can add essential oils in. And just that lovely contact can actually alleviate it. Edema, fluid retention in the body, we can help to remove that through massage as well. So it's a physical contact. It definitely has emotional contact. And for your overall well-being, that time spent with your therapist, letting go and relaxing. In my clinic, I definitely try to get my clients to relax more than coming in and starting to talk a lot about their therapy, what they're going through. What I'm trying to offer is a space for them to just be and to learn how it feels to be relaxed. Often we forget how it feels to be relaxed. And once we learn how it feels to be relaxed, it's kind of like a muscle memory. Does it work with conventional medicine? Absolutely, it does work with conventional medicine. The only time we would ask for your doctor's permission is if you were on very high medication. Maybe you were going through chemotherapy or you're on very high medication. We would definitely seek your doctor's advice as to whether it was suitable for you, simply because if you think logically that we are increasing blood flow into the body, we could be speeding up the rate at which your medication is being taken into the body. It doesn't happen very often. 30 years as a therapist, I have worked with all sorts of different people going through all sorts of different treatment. And this morning I was doing a massage on a client here. So I'm going to talk about my own case study, and a lady this morning that's been coming to me for quite some time, and she came in for a massage this morning. She's just got through breast cancer, and it's that physical contact that she needs, and that after breast cancer and having had to have a mastectomy, just to feel very comfortable with her body and to feel good about being a woman. So that contact and that lovely relaxation that she gets is absolutely speeded up her recovery. So it does work. And again, you can have just parts of you massaged. And I try to get my clients to understand what's actually happening. After massage, we always ask you to drink plenty of water, because if you think we have speeded things up a little bit, that means we're helping to remove waste from the body. So by taking on a lot of water, what's actually going to happen is that's going to actually help you feel better. And when we hold tension in our neck, I mean, we see that all the time. I think any of you could probably look at somebody and you could actually see that they have tension in their neck, and we release it. What we want to do is to educate people through their massage to try and keep it there. What we don't want to happen is they come once and then they go off, and then, that was lovely, and then it goes up again. What we're trying to do is to see people for regular massage, to bring that alignment back to the body, to put that alignment back, that length back into the muscles, so it's not pulling out on the skeletal system, and to make that a very powerful muscle memory. So the client thinks, the client thinks, actually, this is how my body should feel. So in summary, if you are suffering with tension, stress, and you're just finding it very hard to switch off, you would definitely 100% recommend massage. It's going to teach you to slow down. It's going to teach you that lovely connection with yourself, that stillness, that quietness. If you have sports injuries or anything like that, again, it's going to aid and help your recovery. But it's just a lovely thing to do. And in 30 years, I probably couldn't even count the hundreds and hundreds of people that I've massaged. But for me as a therapist, it's definitely about making that connection, being super, super professional at all times, educating you as to why you're having massage, and, hoping then that we can relieve that tension from your bodies. So I hope that helps. I'm a very enthusiastic therapist. I love being a therapist, taking care of people and, and helping people in the kind of world that we live in now to de-stress and feel comfortable with any type of complementary therapy. I think it is a wonderful thing. And I think it's an incredible support to the NHS. And I hope all of you, if you haven't had a massage, definitely try it. Any questions? How was that, Naveed?
Thank you, Maria. That was absolutely fantastic.
Thank you. We do have one question that's come through. Are there any patients' demographics or specific health conditions that, in your knowledge, you feel that may not be suitable to kind of talk about or recommend massage therapy?
Only, as I just discussed, if people are on high medication for any cancer treatments, we would need that support from the doctor just to make sure that isn't speeding up the rate at which the body is absorbing those drugs. So really, that is the only thing. But the thing with people that are having cancer treatments, massage is one of the most amazing contact therapies that people can have. And it really helps. It is such a well-being therapy. Everyone loves contact. From tiny babies. You only have to think what we do with tiny babies and elderly people, both ends of the spectrum. People love to be touched. They love massage. We need to learn to relax. And if we can educate the muscles, it will educate the mind, and perhaps we'll just be more relaxed generally.
Thank you very much, Maria. We've had another question, just something a little bit more specific. Are there any specific medications, or one example is blood thinners, that may have an effect on receiving massage?
Again, Naveed, these type of things that are affecting your circulation, we do need that confirmation, because it would then very much depend on the dose that you're taking, how long you've been taking it, and if there's any underlying conditions. So we would very much then do a full consultation, and if we're ever unsure about doing mesodermia, we'd always ask advice from the doctor first. But really, there isn't many reasons why people can't have massage, even if it's not a full body massage and somebody is on high medication. Just the physical contact of maybe having an arm massage or a foot massage, which then just brings it down a little bit. It's who's ready to get on this couch?
I think you've inspired everyone to jump on there, Maria. Well, thank you very much for that very insightful talk.